Hematolymphoid system and blood transfusion. Chapter number 11, Hematopoiesis and red blood cell disorder. Bone marrow and hematopoiesis. Hematopoiesis is the production of a formed element of the blood. Normally, it takes place in the bone marrow. Circulating blood normally contains three main types of mature blood cell: the red blood cell, erythrocyte, white blood cell, leukocyte, and platelet को कुहाଯାଉଛି thrombocyte. These blood cells perform their respective major physiologic function. Erythrocyte largely concerned with oxygen transport. Leukocyte plays various role in body defense against infection and tissue injury, while thrombocytes are primarily involved in maintaining integrity of the blood vessel and preventing blood loss. The lifespan of these cells in circulating blood is variable. Neutrophils have a short lifespan, less than 24 hours, followed by platelets 8 to 10 days, while RBC have the longest लाइफ स्पैन जो कि 90 से लेकर के 120 डेज होता है. The rate of production of these blood cells are normally regulated in healthy individual in such a way so that to match the rate at which they are lost from circulation. Their concentration is normally maintained within well-defined limit unless the balance is distributed due to some pathologic process. Hematopoietic organ. Hmm. 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 Hematopoietic organ. In the human embryo, the yolk sac is the main site of hematopoiesis in the first few weeks of gestation. By about third month, however, the liver and spleen are the main site of a blood cell formation and continue to do so until about 2 weeks after birth. Hematopoiesis commences in the bone marrow by the fourth and fifth month and become fully active by seventh and eighth month, so that at birth practically all the bones contain active marrow. During normal childhood or and adult life, therefore, the marrow is the only source of a new blood cell. However, during childhood, there is progressive fatty replacement throughout the long bone, so that by adult life the hematopoietic marrow is confined to the central skeleton, vertebrae, sternum, ribs, skull, sacrum, and pelvis, and a proximal end of a femur, tibia, humerus. Even in these hematopoietic areas, about 50% of a marrow consists of a fat. Figure 11.2. Non-hematopoietic marrow in the adult is, however, capable of reverting to active hematopoiesis in certain pathologic conditions. The spleen and liver can also resume their fetal hematopoietic role in certain pathologic conditions and is called extramedullary hematopoiesis. In the bone marrow, developing blood cells are situated outside the marrow sinuses, from where after maturation they enter the marrow sinuses, the marrow microcirculation, and then released into circulation. Hematopoietic stem cell. Hematopoiesis involves two-stage mitotic division or proliferation and differentiation or maturation. It is known for a few decades that blood cell develops from a small population of a common multipotent hematopoietic stem cell. Hematopoietic stem cells have the appearance of a small and intermediate sized lymphocyte, and their presence in the marrow can be demonstrated by cell culture technique by the growth of a colony forming units pertaining to different cell line. The bone marrow provides a suitable microenvironment for growth and development of a HSC, मतलब hematopoietic stem cell. For instance, if hematopoietic stem cells are infused intravenously into a suitable prepared recipient, they seed the marrow successfully but do not thrive at other side. This principle forms the basis of a bone marrow or hematopoietic stem cell. Transplantation performed for various hematologic disease. Hematopoietic stem cells have the following essential feature. They have a capacity to differentiate into a variety of a mature cell type. They have a capacity for self-renewal. They express a variety of cell surface molecules CD34, CD90, THY1, CD117 जिसको बोला जाता है सी किट रिसेप्टर CD133, CD164, CD110, thrombopoietin receptor MPL. Hematopoietic stem cell possesses certain adhesion molecule which assign them the feature of a mobility. These are integrins, VCAM1 and chemokine CXCR4 receptor. When hematopoietic stem cells are infused during transplant, they home to the bone marrow due to chemokine receptor CXCR4. After a series of a division, a hematopoietic stem cell differentiate into two type of progenitors. लिम्फॉइड जिसको बोला जाता है इम्यूनोसिस्टम स्टेम सेल एंड नॉन लिम्फॉइड और माइलॉइड इसको ट्राइलिनेज स्टेम सेल बोला जाता है. The former develop into T, B and NK cell while the latter differentiate into three type of cell lines. Granulocyte monocyte progenitor producing neutrophil, eosinophil, basophil, monocyte. Erythroid progenitor producing red cell. Megakaryocytes as the source of a platelet. Monocyte on entering the tissue forms a variety of phagocytic macrophages, both of which together constitute mononuclear phagocyte system. Page number 120. Lymphopoietic cell in the marrow undergoes differentiation to form B and T and natural killer NK cell of the immune system. The development of a mature cell, that is poiesis, red cell, erythropoiesis, granulocyte, granulopoiesis, monocyte, lymphocyte, that is lymphopoiesis, and platelet thrombopoiesis are considered in detail later under the relevant heading. Hematopoiesis or myelopoiesis is regulated by certain endogenous glycoprotein called hematopoietic growth factor, cytokine and hormone. For example, erythropoietin for red cell formation, granulocyte colony stimulating factor, that is GCSF, granulocyte colony stimulating factor for production of granulocyte, granulocyte macrophage colony stimulating factor, that is granulocyte macrophage colony stimulating factor, GMCSF, for production of granulocyte and monocyte macrophages, thrombopoietin for production of platelets. Each of these growth factor act on their specific receptor to initiate further cell event as discussed under respective topic later. Bone marrow examination. Examination of a bone marrow provides an invaluable diagnostic help in some cases, while in other it is of a value of confirming a diagnosis suspected on clinical examination or on the blood smear. A peripheral blood smear examination, however, must always precede bone marrow examination. Bone marrow examination may be performed by two methods: aspiration and trephine biopsy. A comparison of a two method is summarized in table 11.1. Bone marrow aspiration. This method involves suction of a marrow via a strong, wide bore, short beveled needle fitted with a stylet and an adjustable guard in order to prevent excessive penetration. For instance, Sala bone marrow aspiration needle. Smears, figure 11.4a. Smears are prepared immediately from the aspirated bone marrow and are fixed in 95% methanol after air drying. The usual Romanowski technique is employed for staining, and a stain of iron is performed routinely so as to access the reticuloendothelial stores of iron. The marrow film provides assessment of cellularity, details of a developing blood cell, that is normoblastic or megaloblastic, myeloid, lymphoid, macrophages, and megakaryocytic. Ratio between myeloid and erythroid, that is M/E ratio, cells, storage disease, and for the presence of a cell foreign to the marrow such as secondary carcinoma, granulomatous condition, fungi, एग्जाम्पल हो गया हिस्टोप्लाज्मोसिस, and a parasite, example malaria, leishmaniasis, trypanosomiasis, trypanosomiasis. Estimation of the proportion of cellular component in the marrow, however, can be provided by doing a differential count of at least 500 cell myelogram, table 11.2. In some conditions, the marrow cell can be used for more detailed special tests such as cytogenetics, microbiological culture, biochemical analysis, and immunological and cytological markers. Sala bone marrow aspiration needle. Okay. Hmm. Biopsy needle. Stylet. Jamshidi trephine needle. Sala bone marrow aspiration needle. Sala. Trephine biopsy. Trephine biopsy is performed by a simple Jamshidi trephine needle by which a core of tissue from periosteum to bone marrow cavity is obtained. This tissue is then fixed, soft decalcified, and processed for histological section and stained with hematoxylin and eosin and for reticulin. Trephine biopsy is useful over aspiration since it provides an excellent view of overall marrow architecture, cellularity, and presence or absence of infiltrate, but is less valuable than aspiration or aspiration as far as individual cell morphology is concerned. Key points: bone marrow and hematopoiesis. Hematopoiesis commences in the bone marrow by 4th and 5th month and became fully active by 7th and 8th month. During normal childhood and adult life, the marrow is the only source of a new blood cell. Hematopoietic stem cell in the bone marrow gives rise to two types of a multipotent stem cell: non-myeloid, which differentiate into committed trilineage series, granulocyte, monocyte, erythroid, megakaryocytic precursor, and a lymphoid stem cell which differentiate in the bone marrow and then migrate to the lymphoid tissue, TB and NK cell. Normal adult bone marrow counts, that is equal to myelogram. So fat ओब्लिक सेल रेशियो जो होता है वो फैट सेल रेशियो होता है 50:50। माइलॉइड एरिथ्रॉइड M/E रेशियो जो होता है वो 2 से लेकर के 4:1। दैट मीन्स 3:1। माइलॉइड सीरीज जो होता है 30 से लेकर के 45%, जो कि 37.5। माइलोब्लास्ट जो होता है 0.1 से लेकर के 3.5%। प्रोमाइएलोसाइट 0.5 से लेकर के 5%। एरिथ्रॉइड सीरीज 10 से लेकर के 15%। मीन 12.5%। मेगा कार्योसाइट्स 0.5%। लिम्फोसाइट 5 से लेकर के 20%। प्लाज्मा सेल लेस दैन 3%। रेटिकुलम सेल 0.1 से लेकर के 2%। Hematopoiesis is regulated by a few factors such as erythropoietin, granulocyte colony stimulating factor, granulocyte macrophage colony stimulating factor, and thrombopoietin. Examination of the bone marrow provides an invaluable diagnostic help and confirming a suspected diagnosis. Bone marrow examination may be performed by two methods, aspiration and tryptophan biopsy. Major indication of bone marrow aspiration are typical typing of anemias, major indication of bone marrow aspiration are typing of anemias, leukemias, neutropenia, and marrow infiltration. While tryptophan has additional advantages in dry aspiration, myelofibrosis. While tryptophan has additional advantages in dry aspiration, myelofibrosis, and aplastic anemias. सो आजिकार स्टडी विथ मी ब्लग्स रे एतिकी। बर्तमान टी निद निद मत लगिलानी। एरिथ्रोपोइसिस रु स्टार्ट करिया। नॉर्मली गोटे पेज पढ़ा हला, गोटे पेज पढ़िया पाए गोटे पेज तो नुहे केतटा पेज जदि बोथ साइड काउंट करा हबो 2 तापर ये हे गला 3 4 पेज पाखापाखी, नॉट एक्जाक्टली 4 पेज पाखापाखी आज पढ़ा। सो आज स्टडी विथ मी ब्लग्स रे एतिकी। बर्तमान मते निद लागिलानी। थैंक्स फॉर वाचिंग।